Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about Olecranon Bursitis and how to treat it. But before I begin, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially, Olecranon Bursitis, what it is just at the elbow region, right at the what's referred to as the olecranon, we have a superficial bursa. And so bursa, what they are, they're essentially sacs of fluid that help to lubricate the joint. And just like other areas of the body, it can become, this bursa can become inflamed. And typically this bursa, the main reason why it gets inflamed is with direct pressure. So another name for this condition is actually student elbow, because you'll find that students will get this a lot just simply from prolonged leaning right on this this area, which again causes this pain. So when they're studying, right, it's that direct pressure on the bursa, which will then cause this inflammation to occur. Now, the thing about Olecranon Bursitis is it's a difficult area to really treat directly. Anytime there's a bursitis involved, you basically have to work on it from an indirect standpoint, in that the bursa, you can't stretch it, you can't, it's essentially it's an inert structure, so you can't stretch it or strengthen it, but what you can do is try to minimize, right, the pressure on it. So that's one thing. So you'll want to make sure you're not putting any direct pressure on it. If there's a tendency to lean on that elbow, you're going to want to minimize that. You can ice the area, right, so directly on that bursa. And then they do actually have a specific brace that can be used for this. And basically what it is, it's like a padding that you would wear on the elbow. And again, it's to minimize the direct pressure on the elbow. And by doing this, right, the bursa actually has a chance to heal. So that's the biggest key with this, is just you want to avoid the direct pressure on it to break that cycle, right, of the bursa becoming inflamed. The other thing that can be done is just direct work in terms of stretching the muscles that cross the elbow joint. So that might look like a tricep stretch, right? You could also work on stretching out the forearm muscles. So essentially your wrist flexors and extensors, that can indirectly have an impact on it, help in terms of circulation. And anytime, right, we increase circulation, that's going to help in terms of blood flow, obviously, and getting rid of any excess edema or inflammation in that area. But the main key, right, as I mentioned before, is minimizing the direct pressure on it and allowing it to heal. Now, for some individuals, for some patients, that bursa, that bursitis, it can remain and can be somewhat stubborn. So you get this actual physical swelling on that olecranon area. And so passive treatments can also be helpful. So therapeutic ultrasound, acupuncture, these things can be helpful, particularly if that swelling is staying there. And then in extreme cases, some patients will actually get a cortisone shot directly in the bursa. And again, this would be when all the conservative methods have essentially been exhausted, and they've talked to their doctor about this, and that's another option that some patients will do after they've discussed it with their physician. If you have any questions or concerns, feel free to leave a comment below, and please make sure to check with a physiotherapist to make sure that these exercises is appropriate for you. And thanks again for watching. Have a great day. Take care.